Dr. Garima Asati. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic malaria in English on the demand of few of my patients who cannot understand Hindi. So it's an English explanation for them. Malaria is a mosquito-borne disease and most common disease, spreading widely, especially in rainy season. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last so that at the last some of the homeopathic medicines are given which can cure this malaria. Now I am going to tell you about the signs and symptoms of malaria. At first, the incubation period, that is just after the mosquito bite and the first symptom which presents, that duration is called as incubation period. So that is especially about 8 to 25 days in the cases of malaria. So just after the mosquito bite, the first symptom which appears must be within a duration of 8 to 25 days. Then it is termed as malaria. So the sign and symptoms which it represents are headache. It is a very severe headache, continuous headache, along with fever, along with shivering. Fever is continuous with the shivering and chills. Along with that, there is joint pain and there must be vomiting along with that headache. There is hemolytic anemia, means RBCs gets broken down and causes this hemolytic anemia. There may be the symptoms of jaundice too. It can also lead to retinal damage and hemoglobin may come out in urine too. So these are the sign and symptom. Sometimes it may lead to convulsions too. Friends, now I am going to tell you about the classical symptom of malaria. So it is a paroxysmal fever which occurs at a fixed duration or fixed time. There is a cyclical appearance and cyclical occurrence of the symptoms. There must be sudden coldness. So shivering, after then there is fever, after then there is perspiration, that is profuse perspiration occurs at the last stage. So it is a cyclical recurrence of these symptoms. Now fever in every 2 days is called as tertian fever, which is caused by Plasmodium vivax and Plasmodium ovale. And if fever occurs in every 3 days, it is termed as quartan fever. So it is also periodical, which occurs in every 3 days and which is caused by Plasmodium malariae and Plasmodium falciparum. Recurrent fever occurs which can remain from 36 to 48 hours. That continuous type of fever is a sign and important symptom of this malaria. Now friends, I am going to tell you about the complications of this malaria. First complication is cerebral malaria, which can cause neurological symptoms like conjugate gaze palsy, nystagmus, opisthotonus, convulsions, seizures, coma, and eyes may not be aligned together. There are some more complications like respiratory distress because of the metabolic acidosis, renal failure because RBCs gets break down into hemoglobin and which comes out through urine. So it is also known as black water fever. Enlarged liver or spleen can be seen along with this as a complication of malaria. Spontaneous bleeding can occur which can cause this shock and coma, coagulopathy also. Malaria, if occurs in pregnant women, can cause IUGR, that is intrauterine growth retardation, infant mortality, stillbirth. or low birth weight baby, or it may lead to abortion too. Now I am going to discuss you about the cause of malaria. As you all know, mosquito bite is the common cause. So the malarial parasite is Plasmodium falciparum and Plasmodium malariae. These are the two most common cause which are widely spread in India. And Plasmodium vivax and ovale are the rare varieties of this Plasmodium which can cause this malaria. Now I am going to explain you about the exact cycle and pathology of this malaria. Male mosquitoes do not feed on human, they feed on plants only. And female Anopheles mosquito is responsible for causing this malaria. It bites an infected person, takes the gamete inside, and inside the mosquito this maturation takes place, and then it bites the non-infected person and leaves their spores again there, and that non-infected person gets infected. They usually bite in dark, in dawn time or in night. Some persons are genetic resistant, like who suffers from thalassemia or sickle cell anemia. Friends, now I am going to tell you about the diagnosis of this malaria. So blood test can be done for platelet count, for malarial parasite, and tests can be done for enlarged spleen and liver, that is USG can be done for that. Now I am going to tell you about some of the symptoms which tells us that malaria is going more worse, patient's condition is going more worse. And those symptoms are decreased consciousness, weakness, inability to walk, unable to feed, and blood pressure may get low, that is below 70 mmHg for adults and below 50 mmHg for children, and 2 or more convulsions if occur. Acidosis or lactate levels greater than 5 millimole per liter, blood glucose level becomes less than 40 mg per dl. Along with that, if there is breathing problem, circulatory shock or kidney failure, these can lead to the worst condition of the patient if suffering from malaria. There may be pulmonary edema too. Now I am going to tell you about the prevention of this malaria. So we can use insect repellents like DDT, mosquito killer like All Out, or you can use coils or these pesticides, insecticides. Along with that, we can use net to control this insect bites or mosquito bites. Along with that, never store contaminated water. These helps and measures can help you from being bitten from this mosquito. Treatment for it is anti-malarial drugs in allopathy. Now, homeopathically, the cause is virus infection. It can lead to only those who are susceptible to it, where immunity is low. But if it is a sudden and violent reaction of a patient or a person, then there must be anger behind it. A girl aged 13 years suffering from recurrent malaria. She was suffering from since 3 months. As antibiotics were taken, it gets suppressed and again reappear in next month. So there is a recurrency since 3 months. So suppressed and recurrent malaria occurring since 3 months. She came with the symptoms of the peculiar and characteristic symptoms of malaria, as there was chill, then there was fever, then thirst, and then heat. There is a stage of perspiration just after fever. So she came with all these symptoms of malaria. There was fear of misfortune. Along with that, there was forgetful for the name of objects. She suffers from chill, and that chill is from 3 p.m. to till 10 p.m. There was a delirium during heat, profuse perspiration, profuse sweating along with thirst. There is headache along with diarrhea and anxiety about future. And the rubric taken was delirium during heat, and the medicine given was Chininum Sulf 200, which cured her completely within 5 days period of time. Friends, now I am going to tell you about some of the homeopathic medicines which can cure this malaria. So the first medicine is lachesis. What actually lachesis person's nature is, I am going to tell you about that. So in advanced diseases, in advanced cases, patient may become prophetic or clairvoyant. So his thought process becomes beyond normal, becomes communicative, expansive. 1 minute short message can take the time of 10 minutes. He becomes manipulative, dictatorial, dominating, but internally he is timid. He is a bleeder or she is a bleeder. So the lachesis is a bleeder remedy. Malaria symptoms is every spring this malaria recurs. There is a recurrency tendency of this malaria in lachesis. Chill and heat alternate with each other and patient is too much restless during this malaria. After the suppression of quinine, if malaria occurs and along with these symptoms, lachesis can be helpful. Next medicine is China. So there is a paroxysm of chill, then thirst, then heat and then thirst. So after every chill and heat, thirst may be followed. Patient remains anemic, desires sour fruit and cannot bear to be touched or looked at. There is ailment from bad news, having tormented feeling within, and there is loss of vital fluids. So in such cases, China can be helpful in curing malaria. Next medicine is Lycopodium. So malaria along with enlarged liver, this Lycopodium can be helpful. So there is icy coldness, patient feels as if lying on ice. One chill is followed by another chill and then vomiting occurs. There is sour irritation and sour vomiting along with this malaria. The remain hands and feet are cold and the rest body is hot. There is a chill stage mainly and heat stage remain for a short time. Now the nature of the Lycopodium is he remains hard on inferior and soft with superior. Quarrelsome nature, who talks loudly, weeping loud, 4 p.m. to 8 p.m. aggravation, and who can talk on one subject only. So along with these symptoms, if the malaria was there and enlarged liver is there, then Lycopodium can be very much helpful. Next medicine is Eupatorium perfoliatum. In this, chill starts at 7 a.m. which remains till 9 a.m. And the malaria is a periodical fever in this tertian and quatern. It covers the both. Along with that, there is bony pains. That is, bones get too much painful and excruciating pain is there in the bone region. Patient moans and cries with this pain. There is sadness with this pain and along with that there is perspiration. Patient feels that I am going out of mind, especially in night. There is a sense of going out of control, out of mind. So in such cases, Eupatorium perfoliatum can be very much helpful. And the last medicine is Magmure. So in this, there is 14 days aggravation time and 14 days amelioration time. Means fever remains for 14 days and then he become alright for 14 days. It is a fortnight remedy. There is chill even near a stove and gets better in open air. There is a shuddering for a short time and in heat stage he is having aversion to uncovering. There is sweat from 12 p.m. till morning and the patient is very much sensitive to noise, weeps very easily and delusion that he is friendless. So in such cases, Magmure can be of very much helpful in curing malaria. That's all for today. We'll meet soon with a new topic, new subject. Friends, clinic address of mine and the contact number is given in the description link. You can see it, and kindly subscribe my channel if you have not subscribed till yet, and press the bell icon to get the update of the latest videos. And it's my humble request not to take any medicine without the permission of doctor. Kindly consult the doctor before taking any medicine. Stay connected to stay healthy. Thanks for watching.